My interpretation of all of this, and my brother's a psychiatrist, so I get to move into mental health issues, is this vulnerability, this susceptibility to disaster is a cause of ongoing anxiety. So now I'm offering you mental health advice. But seriously, all of us, who feel vulnerable that we could lose our insurance, that's a source of worry that doesn't exist in a lot of other countries. Here's my report card. I think the colors actually came out reasonably well. What I've done is I've done two of these. One is for the Obama healthcare reform. And again, Obama healthcare is a shorthand for all that is going on in Washington now. On the top line is coverage. So according to my assessment, I think that the Obama health reforms will substantially help with coverage. We're at currently 85% insured. Maybe it'll go up to 92 to 94%. And that's because there are various mechanisms, as you've heard, to get more people insured, including a lot of people who currently can't afford insurance. I think the highest scores for Obama reform, despite the slight variations in how it's being approached, as Ken described, are for pre-existing illness exclusion. There will no longer be an exclusion based on pre-existing illness. You can be sick and still get health insurance. This is really important. Chronic disease premium cost. You can be sick and still get affordable health insurance because all of the proposals in one form or another have a community rating. They base what you pay on where you live and perhaps your age, but not your illness status. No more rescission. That's the stuff that President Obama spoke about, where someone who had insurance had it taken away for specious reasons in the examples he gave when they got sick, because the insurance company didn't want to pay. That will be prohibited. Another strength, perhaps not quite as strong in my view, although it's a real challenge, is improving primary care. Primary care has really suffered in recent years. As was pointed out earlier, the Medicare system has increasingly undercompensated primary care. And there's some interesting stories there about politics in Washington as well as politics in the American Medical Association. From what I understand from people who talk with the administration and work with them on primary care, there's a serious commitment to begin to rectify that problem. Quality of care also is likely to improve in two ways. There's something called accountable care. It's a way to take an organization, a healthcare organization, Mayo Clinic is perhaps the most famous, and to provide team care that is higher quality and lower cost. And this comes now under the catchphrase accountable care, and I think there's a lot to it. The other sort of technical catchphrase is comparative effectiveness. That's comparing how well therapies work in real practice, not in clinical trials, but in real practice. And there's a lot of potential for improving quality of care through those methods. The medical malpractice stuff will probably be addressed as well. That's one that seems to comfortably cross partisan lines. Where I believe that Obama healthcare doesn't look so good is on the comprehensiveness of benefits. As you've heard Ken describe, in an attempt to control costs, benefits are being cut. For example, high deductibles and, in some instances, pretty high annual caps. So with a question mark, I think things will get worse on the comprehensiveness of benefits with the current reform strategy. Financial burden to individual is a related issue, and I think it's also likely to get worse. Administrative burden and costs, my favorite topic, gets an X here. You can hardly see it, but an X in the red. Not only will more people be insured through private insurance, which is the most administratively complex, but now you're going to have to manage various subsidies and mandates and have all sorts of record keeping to be sure people are following the law or have an exemption if they're not following the law. It's going to add a substantial burden in my view. Insurer profits, which I consider a negative in the system, will get worse, that is bigger, because there will be more people forced or subsidized to buy private insurance. Federal government costs, if we believe the president, and I think I do, roughly no change. There will be costs for the subsidies, but these accountable care organizations are probably, I'm optimistic that they will work, and there are other ways to save money. It'll probably end up only 9 cents more expensive, not a dime. System costs, I think that overall system costs will go up, more people will be insured, which is good, more people will get care, which is good. There will be no counteracting savings, unlike under a single payer, which I'll come to in a moment. This is how single payer works. Typically, funds come from employer and employee contributions, which, as Ken has pointed out, are pretty much indistinguishable. Money typically also from taxes on income, high-level income, and tobacco, and some out-of-pocket contributions, usually modest. They go into a single public financing pool, which has one benefit package, and that goes to the doctors, the hospitals, the pharmacies, etc. The provider column, and there's only one array of arrows because there's only one payer. It's much simpler. You save very substantial administrative costs, probably a difference of 15%. That's where I get the $400 billion a year. Most of that, maybe not all of it, but certainly most of it, could be saved. So how does the report card look for single payer? I didn't fill this report card out before I looked at it. I really, no, this is, my assessment is, and I fully acknowledge the political challenges of getting there, but my job tonight is to talk about the benefits of getting there. In my view, the coverage problem is solved. Other countries with single payer coverage approaches 100%. Just as with Obama reform, pre-existing illness problems, chronic disease, cost of premiums, rescission, all of those are solved. Three areas where I think single payer might be slightly better than Obama healthcare, just because with single payer you have a little bit, you have more levers, more ways to influence what doctors and hospitals do. We do pretty well on primary care, strengthening quality of care, and medical malpractice. Where single payer really looks better, in my view, is the comprehensiveness of benefits. You've designed a benefit package that basically covers the care that people need. You might leave out some certain pieces if you have to, certain kinds of eye care, and certainly certain kinds of elective surgery. The financial burden to individuals is helped by the fact that you finance it progressively through the tax system, and you have very low cost sharing, or sometimes none. The administrative burden, that's really, again, something that I think about a lot. That's where you get huge savings. It may be a one-time savings, but it will continue every year, of savings in the order of $300 to $400 billion a year. Likewise, insurer profits are no longer an issue because there are no longer for-profit insurers, except there may be a small peripheral market for things not covered under single payer. Federal government costs go the other way. Because probably, or government costs, I should say, may be done at the state level. There's probably no way to do single payer that doesn't involve bringing more money into the government and sending more out. So the budget grows on net budget neutral, and overall the system saves money because of the savings of administrative efficiencies and bulk purchasing.